Hello, welcome to another episode of Your Health, Your Life. First of all, I'd like to begin by thanking our viewers out there that are out there to support us. We're very grateful for you. We only exist because of you. So very grateful for all the messages of support that you keep sending to us. Those keep us very much encouraged as a team from Your Health, Your Life. Today I'm going to be discussing a topic that you may not be familiar with, Hepatitis B. So hepatitis B, what is it? Well, we're going to begin by saying that hepatitis B is actually a virus. And this is a virus that is going to affect your liver. Primarily, hepatitis B is going to cause damage to the liver, but it may also cause damage to other structures in the body, like the kidneys. But our main interest today is in hepatitis B infection of the liver. So we've already mentioned hepatitis B is a virus, and we have mentioned that it affects your liver. How is hepatitis B transmitted? Well, like HIV, hepatitis B is transmitted through body fluids that you can get into contact with, especially during sexual intercourse. You can also have transmission of hepatitis B by a blood transfusion in case the blood is not properly screened for hepatitis, and if it does have hepatitis B, you're likely to get hepatitis B. You can also have minor methods or minor ways through which hepatitis B can spread. These are potentially very possible as well, that includes sweat as well as saliva. Now, I'm sure most of you out there are well aware about HIV disease and are familiar with ways in which you can protect yourself. But there are very few people out there that are quite familiar with hepatitis B and how we can protect ourselves from it. So, we've already mentioned how hepatitis B can be transmitted. So, what symptoms can somebody with hepatitis B present with? Well, somebody with hepatitis B can present with symptoms of nausea, vomiting, abdominal pain. Depending on the extent of disease, some of them can also present with yellowing of the eyes. Others may also present with yellow stool as well as yellow urine. All those are just signs that your liver generally is not doing very well. In addition to the things we have mentioned, some patients will also present with generalized body weakness and malaise. There are a couple of tests that your healthcare provider will be able to test for to confirm that you actually do have hepatitis B. Now, in most cases, you don't necessarily need to be on treatment just because you test positive for hepatitis B. There's a certain criteria that we have to consider, a criteria that we have to look at to ensure that you have met for you to qualify for treatment for hepatitis B. That is so because most of the patients that have hepatitis B, more than 90% of the patients may not necessarily require treatment, but just close follow-up by the clinician that is seeing you in whatever respective health center that you're being attended to in. For the few that qualify to treatment, they may have to be on treatment, and the length of this treatment is going to vary depending on their response to treatment. It might take as long as a year and even over. Some patients even take the treatment for as long as 2 years. So now, why are we talking about hepatitis B today? For the small percentage of people that have fatal complications of hepatitis B, they progress to go on complete liver failure. Others even go on to have cancer of the liver. One thing I want you to appreciate about the liver is that the liver is the only organ in the body that has the ability to heal itself. However, once your liver progresses to these complications that are coming from hepatitis B infection, like we have mentioned, some people tend to have an enlarged liver. As a complication, other people may also have the size of their liver shrinking in size. And this happens because of continuous damage that goes on. Others may progress to have cancer of the liver. Now, all these conditions that we have mentioned may require you to have a heart transplant for it to be treated completely. And currently in our setup, we're unable to have a heart transplant. A liver transplant. And currently in our setup, we're unable to have a liver transplant. So that is very essential for you to note. So if you do have those ongoing complications of hepatitis B, like we have mentioned, your liver becoming bigger, your liver becoming smaller, or you develop cancer of the liver because of hepatitis B, things may not go well for you, especially in our current locality. Now, what things should you keep in mind when you do have hepatitis B? First of all, you have to avoid anything else that is going to worsen the damage on your liver. You have to stop taking alcohol, and you may also have to avoid certain types of food, but we'll not get into the details of that. The key thing is that you have to avoid alcohol, and you also have to avoid drugs that may potentiate or worsen the damage that is already in your liver. How can you prevent yourself? Well, the first thing is avoid having unprotected sex and try to minimize your sexual partners. If possible, stick to one sexual partner. Yeah, that's one thing that you have to take from this. What other thing can you do? You can go for screening. A lot of people out there go for screening for HIV and AIDS, but very few people out there go for screening for hepatitis B. If you're listening to this program now, I'm sure you've had an HIV test before, but have you ever had a test for hepatitis B? Now might be the right time to do one. In the event that you don't have hepatitis B, the bit about hepatitis B, unlike HIV, is that there's a vaccine for hepatitis B that you can get and you can protect yourself. Because the last thing you want is to have hepatitis B that can eventually progress to severe forms of liver disease, and that's not something we want you to do. So we want you to know that there's a vaccine out there for hepatitis B and it's very efficient. Please get it and have yourselves all those doses that are required for you to have full protection. We hope you really benefited from this video, and please, if you did, please share it to everybody else so that it might help as much people as possible. Also, like we have been mentioning, I think over the last few weeks, we have partnered with another company, Medical Health Consultancy, and the main role is to screen employees and also to give health talks about current things that are happening that may be of public interest. For more information, please get in contact with us, and we'll be able to fill you in on how best we can help employees that are working in the government or the private sector. Have a lovely day.